Well, hey there, it's Chris. Nothing's ever going to go perfect, so might as well get started with this thing. I put together some research today trying to dig into what's going on behind the scenes, and what I found is kind of shocking, eye-opening about what's going on with Medicare. Now, you may tell me in comments that the sound does not match my voice. It's something I'm working on with the camera and the technology. So if this is not perfect, let me apologize right away. If you want to ask a question or give a comment, feel free to do so on whatever platform that you're watching this on, and we'll see if we can get this thing going. So I want to share with you what I've been learning over the last few days regarding the shocking announcement of the 14.8% increase in the Part B premium. That's the premium that everyone has to pay to participate in Medicare. Whether you're under 65 and on Medicare due to disability, unless you're getting Social Security disability and Medicaid help, where they may pay that for you, or you're over 65 or even on a Medicare Advantage plan, you still have to pay the Part B premium to be on Medicare. And so this impacts more than 55 million people that are on Medicare right now. So my concern was, how did they come up with this arbitrary number of $170.10 for 2022? And that's what we're going to look at today. So I've made some slides here of some things that I've found, and I think you'll find them just as interesting. Now, we all know that Social Security. Well, I'll tell you, first of all, the bad news and then the good news, okay? And I'll make this quick and easy, as quick and easy as I can make it. There's some details that I'll have to go into so you can understand some behind the scenes things happening here. And some of it's pretty shady. I'll just let you know right off the bat. And it makes my spidey sense go off that something's just not right. But I'll share with you the facts and you be the judge. So we all know that inflation is at an all-time high. Yesterday, I heard in the news it's a generational high, has not been this high in a very long time, since the 70s, which was when I was born. But anyway, this is no news to anybody. Everything's costing more. Bacon, eggs, meat of any kind is costing a lot more. So Social Security, look at this spike in the consumer price index, upon which Social Security bases their decision whether or not to give a cost of living adjustment with Social Security. So they did that. They announced it. Everybody was happy. 5.9%. Going to jack up that Social Security income so that people can accommodate more toward this huge shift going on with inflation. So at first, that seemed like a good idea. It was going to be good for everybody. And I'll show you the average person on Social Security was going to get about a $93 increase every month, which is still not a lot. But I want you to see this and see the arrow here, how it is really pointing at what's going on with the ease in which the cost of Medicare is going up. Now, these are the cost of Medicare anticipated in the future. And you can see even historically, 2018 to 2020, how these things have been consistently and gradually, that's the key here, gradually going up. Well, if they're gradually going up, then why do we all of a sudden have this huge spike in the cost passed on to seniors of the Part B? Going from 148.50 to 170.10 is a drastic spike. And that, my friends, that is the subject of today's presentation. We're going to look behind the scenes and what is different this year than all the other years. And I think you'll be surprised to know, many of you won't be surprised to know, just how big pharma is behind this. And I've got the proof, the documentation to share that with you. So here we have the Medicare Part B premiums over time. You can see that historically they've had a small jump there, but you'll see that this year, look at that massive increase. I mean, you can just tell. Let me go back a couple of slides so you can see where we were. There we go. Look at this nice, easy chart, right? Nice, easy chart. And now we see the huge increase for this year. So what is it that they attribute that to? Well, if you read the announcement from Social Security, from CMS, Center for Medicare and Medicaid Services, it had this little nugget in there. And let me share this with you. I'll do a lot of reading today, but I'll try to keep it minimal. This rate increase, they're saying, reflects the need to maintain a contingency reserve. Never happened before, folks. Never happened before. A contingency reserve for unanticipated increases in healthcare spending in the future, particularly certain drug costs. There is significant uncertainty regarding the potential for future coverage. Potential hasn't even been determined yet that they're going to cover it. Future coverage of clinician-administered It's an office infusion, Alzheimer's drug, 𝗰𝗹𝗋, requiring additional contingency reserves. Future possible potential. Those are the words in that sentence. Potential Medicare drug coverage is currently the subject of a Medicare National Coverage Determination analysis. They're looking at it, which, if covered, could increase Medicare spending. The proposed National Coverage Determination on 𝗰𝗋𝗋, as well as any drugs in this category, is still to be determined. So my question was, when I was doing my walk and announcing this the other day, the huge part of this, and they're saying in an interview they did with CNN after the fallout this week, CMS said that this is only contributing about $10 to the total cost. Well, the seniors that I know would much rather pay even $160 a month than $170.10. You may think that it's little, but when you multiply that times 55 million Americans, it's pretty dang significant. So we're going to look at it a little bit closer, and I want to read for you just a little excerpt from this here article. Cost and controversy are limiting the new Alzheimer's drug. Now, this came out last week. And for those that are watching this in the future, this came out November the 8th, 2021 from NPR, the government's news branch. It says the new Alzheimer's drug, 𝗰𝗋𝗋, isn't reaching many patients. This is last week. It's not reaching many people. And doctors say reasons include its high cost, insurers' reluctance to cover it. Why? We'll look at that. And lingering questions about whether it actually slows memory loss. The pendulum of public opinion, an Alzheimer's specialist says, has swayed strongly against this drug, says Dr. 𝗰𝗹𝗋𝗶𝗰𝗲. He's an Alzheimer's specialist at the Barrow Neurological Institute in Phoenix, Arizona, who has worked as an advisor to Biogen, which makes the drug. 𝗰𝗋𝗋 is the first drug on the market able to remove amyloid. Not quite true, as we'll see. The sticky substance that builds up in the brain of Alzheimer's patients. It's also the first new Alzheimer's drug approved since 2003. It's the very subject of that approval that we're going to look at. 𝗰𝗋𝗋 is intended for patients in the early stages of the disease, a population that represents about a quarter of the 6 million people in the U.S. with Alzheimer's. The Food and Drug Administration granted conditional approval in June 2021, even though an advisory panel recommended against it. Their advisory panel. Since then, sales have been very slow, slower than analysts expected. Biogen reported that in the 3 months following its approval, 𝗰𝗋𝗋 brought in $300,000, a very low number for a drug with a price tag of $56,000 a year per person. Insurers aren't paying. One major reason for the lackluster demand so far is that insurers are hesitant to cover the drug. The federal Medicare program, here we go, which insures most people with Alzheimer's, won't decide whether to pay for 𝗰𝗋𝗋 until sometime in 2022. Well, if they haven't determined if they're going to pay for it or not, why are they making you pay for it right now in advance? Never happened before. Private insurers appear to be waiting for the government's decision before determining their own coverage policies. And now we're getting to it. In the meantime, patients and their families who want 𝗰𝗋𝗋 will have to pay out of pocket. Quote, I'm just not aware of that many people who could shell out $56,000 per year right now, says Dr. Maya Yang, an assistant professor of geriatrics at Atrium Wake Forest Baptist, who has criticized the FDA's decision to even approve 𝗰𝗋𝗋. Some patients have asked Dr. Yang about the drug. She says, once I explained to them the potential benefits and side effects, no one has said sign me up. Of the 2 large studies of 𝗰𝗋𝗋 submitted to the FDA, there were 2 studies. This is really important. One found that the drug was able to delay the loss of memory and thinking, while the other found no clear benefit. That equivocal result has confused patients and divided doctors and medical institutions that provide Alzheimer's care. The Alzheimer's Association is a strong supporter of the drug. Meanwhile, some large medical centers, including Cleveland Clinic and Massachusetts General Hospital, say they aren't prescribing 𝗰𝗋𝗋. Quote, this is not a cure, is the message patients are getting from Dr. Zaldy Tan, who directs the Memory and Aging Program at Cedars-Sinai in Los Angeles. Quote, the disease will continue And perhaps the best case scenario is that someone will get a modest improvement in their cognition, but it's not going to stop the disease from progressing. Tan also tells patients that the drug's potential to offer any benefit is still in question. What's not in question, I've highlighted this, so I make it more emphasis. What's not in question is the fact that it can cause cerebral hemorrhaging and swelling in a significant number of patients. So I think that's not something that they will need to consider. I think that is something they will need to consider when deciding whether or not to take this drug. Despite the risks and uncertainty, patients are curious about Aduhelm. Quote, Dr. Sabak says, my phone was ringing off the hook after it got approved. And every patient, every visit since then, they're like, I want to hear more about this drug. Sabak says he also emphasizes the positive when he speaks about Aduhelm to patients in the early stages of Alzheimer's. Quote, here's a new opportunity to see if we can slow it down. Maybe you keep what you have a little longer. Maybe you delay getting worse. But he also notes a word of caution. We're talking about a monthly infusion. There are costs, there are authorizations, there are MRIs, there are risks, there are complications that we need to manage. So far, only a handful of his patients are actively taking this. So this is another interesting part down here. The pandemic has taken a toll on people. That's what they're more focused on. Perhaps as a result of that, quote, this is Dr. Rajesh Tampi, geriatric psychiatrist at the Cleveland Clinic, and they've decided they're not covering it. He says, not a single patient has asked me for the drug yet. I guess most of us didn't anticipate that it would be this imperfect. Imperfect? What's he talking about there? Well, I'll show you. So this is another story that came out yesterday. Is this timely or what? Just came out yesterday. Now, yesterday, for those not currently watching this live, today is Tuesday. Yesterday was Monday. The federal government, CMS, dropped the news about Part B being influenced significantly in its rate increase for all Americans on Friday night. They dropped this Friday night. Monday, this happens. This is huge. Their head guy retired. The guy who came up with this. Let me read you just a couple of clips from this. In a surprising update, Biogen announced Monday, literally the business day after Medicare blamed this for raising Part B costs. Its top scientist, Alfred Sandrock, who led development on some of the company's most important medicines, will retire at the end of the year. His departure comes at a difficult time for the company. He's called home. Revenue has declined over the last 2 years, putting pressure on Biogen to bring new lucrative products to market. A closely watched and recently approved Alzheimer's drug was meant to be the company's answer, but so far it hasn't lived up to expectations. Controversy surrounding the drug, which is known as Aduhelm, has also led to a federal investigation. Oh, it gets interesting. There's now a federal investigation going on about this drug, and yet you're paying for it. Investigation about its expedited approval, along with criticism of Biogen's standards for collecting and analyzing scientific data. What's more, the safety, which was already of particular interest to doctors and patients, is even now more in focus after a 75-year-old patient who received the drug has died. Biogen, remember how many people are taking it? They've made $300,000 in revenue. It costs $50-something thousand per patient. How many people could possibly have been taking it at this point? And yet one's already died. Biogen said it's investigating the death. That Sandrock is leaving in the midst of these challenges leads some to believe this is odd, especially given how much of a key player he has been in the company's development. Quote, this strikes us as rather an abrupt departure, as we have had zero signal that he was approaching an exit, particularly as he has been the most public voice at Biogen defending this drug's data and approval process, an analyst at Baird wrote. How interesting is that? Another article that came out just a couple of weeks ago. Following the approval of the Alzheimer's drug, Aduhelm, the litany of controversy around it. Let's just look at just a little bit of the controversy. This study, which I've linked down here below, and you can see it. I'll put it in the show notes of the video. In March 2019, Biogen and its partner, Eisai, terminated the 2 phase 3 trials of 𝗰𝗹𝗻. Remember how I said there were, and I held up my fingers, 2 studies? Important here. They were terminated. They were not even finished, following an analysis that showed that the trials were unlikely to meet their main objective, which was slowing cognition and functional impairment of patients with early-stage Alzheimer's. It was sought to be a great drug, and they shut down the trials because they showed that it was unlikely to meet their objective. So why are we talking about it? Furthermore, why are we paying for it? The article continues, it was devastating news for the Alzheimer's community, including families of trial participants like Jerry and Jim. After Jerry and her fellow participants were taken off the treatment, her condition progressed faster than before, Jim said. Then, in October 2019, the roller coaster ride for 𝗰𝗹𝗻 trial participants took on a new turn. Biogen and Eisai, whatever, showed that in a new analysis, remember they shut down the trials, but they looked at it again. In a new analysis, the drug appeared to slightly slow the decline of patients who received the highest dose of the drug in one trial. The other trial failed to show any benefit. That's small print. Since then, the drug makers have relaunched clinical trials, and Jerry has been receiving monthly infusions of the drug again. But Jim theorizes that the window of opportunity for effective treatment has passed. Now, I hope the audio on this works. I want you to see what they said about this on CNN. It's kind of interesting.
In June, the FDA approved the use of a new drug for early phases of Alzheimer's disease, despite an FDA advisory committee concluding there was not enough evidence to support the effectiveness of the treatment. In a new piece for CNN.com, Jeffrey Toobin takes a behind-the-scenes look at what one FDA advisor called, quote, probably the worst drug approval decision in recent U.S. history. Jeffrey Toobin is back with us now. The advisory board was basically unanimous in saying, don't do this. And then the FDA did it.
It is. And you know, this is such a huge problem in the United States now. I mean, I know it from my own family. Alzheimer's it is a growing problem. It's the 6th leading cause of death in the United States. It is causing unending heartbreak for families. There has not been a new drug approved for Alzheimer's since 2003 until 𝗰𝗹𝗻, which is this drug made by Biogen, a company in Cambridge, Massachusetts, was approved this year. But the question is, does this drug even work? And the answer, according to the experts, was no. And now patients are stuck with this terrible dilemma of, do they ask their doctors to try this drug, or do they respect the experts and say it's not going to do any good anyway?
So what should patients do, or how do they approach this?
I think it's, you know,
Dr.
we have to ask Dr. Gupta about that. It's a really hard problem because there is this movement in the United States beyond just this drug called the right to try, which is, you know, if a drug isn't actively harmful, let people try it. And that seems to be the direction the FDA is going.
What do you think about that? They're all shocked about it. So, interesting to note, what are the rest of the world doing with regard to this drug? Well, guess what? They're not covering it either. European drug regulators signal rejection likely for Biogen's 𝗰𝗹𝗻. They said, moreover, the results of both trials were the product of a reassessment that took place. After Biogen originally announced that in 2019, each had failed, making the company's conclusions even more tenuous. The FDA, however, worked unusually closely with Biogen to evaluate the data of shut-down studies, a collaboration that stemmed in part from an off-the-books meeting between Sandrock, that's the guy who just quit abruptly, and a top agency official that was reported in the story. They're working closely together. The drug had failed. They stopped the studies. Now, all of a sudden, they approved it anyway because they collaborated with the top of the FDA, who, by the way, the head of the FDA was the one that referred this to the Office of Inspector General for a new investigation. That's where we are right now. That's what's going on. Here's that study. HHS Watchdog, that's the Office of Inspector General. We've covered them before and what they've done with Medicare. Won't get into that right now. But the top watchdog, which is the OIG, to review FDA accelerated approval process after 𝗰𝗋𝗋 controversy. Not just because of drug approvals in general, no, specifically about this drug. Quote, typically the agency looks for multiple large clinical trials. That's what they're looking for drug approval. Multiple large clinical trials. This one had 2 clinical trials that they shut down before they even finished. One showed possibly some benefit that before they said had not happened in other drugs, which is not true. You'll see in a minute. And then the other of the 2 studies that they both shut down had no benefit whatsoever. So typically, this is from the FDA, they look for multiple large clinical trials to generate positive results before it clears a drug for the market. But with this drug, the 2 trials that were supposed to show it can slow down cognitive decline associated with Alzheimer's had starkly different outcomes. One trial succeeded, according to Biogen, while the other found patients given 𝗰𝗋𝗋 actually did worse. Not the same as a placebo. They did worse. The contradictory data and the ways in which Biogen analyzed them led to the FDA's own statisticians and advisors to conclude there was not enough evidence to approve the drug, and yet the FDA still did. Interesting. This is the drug you're paying for. The agency gave 𝗰𝗋𝗋 the green light on June 7, 2021, and granted it a surprisingly broad label with little restriction as to who, among the estimated 6 million Alzheimer's patients in the U.S., was eligible to receive it. Remember how they said before, only the initial phases of Alzheimer's is it shown to be effective? But no, they can give it to all of them. After considerable pushback, don't know if you know this in the news, but 2 of those people quit from the FDA advisory panel because they didn't listen to them. One had already recused himself because he was involved in the study with Biogen. It's just crazy. After considerable pushback, the FDA later revised the label to recommend doctors treat patients with mild dementia. The approval itself wasn't the only point of contention. It had become apparent, move myself out of the way, in the months leading up to the FDA's decision that the agency had worked closely with Biogen. That's not supposed to happen. It's called a conflict of interest. It's called a violation of ethics. They worked closely with this company. Interesting. I wonder if any money changed hands with those folks. Just asking a question. During its review process, recent reports, though, detail just how unusual the relationship was. According to STAT, an off-the-books meeting in 2019 between a top Biogen official, maybe one that just quit, and the head of the FDA unit that evaluates new brain drugs laid the groundwork for Project Onyx, a secretive Biogen initiative to get 𝗰𝗋𝗋 approved. Wow. Secrets, folks, and yet you're paying for it. So some of the top organizations in the country have looked at this, and what are they saying? They're saying, no, we ain't going to cover it. Cleveland Clinic and Mount Sinai will not administer this drug. Interesting, huh? First reported by the New York Times, the Cleveland Clinic and Mount Sinai have decided not to administer the drug, which was cleared for market in June, sold under the brand name 𝗰𝗋𝗋. Cleveland Clinic said its decision was based on available safety and efficacy data. I love that word. While an official for Mount Sinai said the health system won't consider giving approval until a federal investigation affirms the integrity of its approval. Until a federal investigation. Well, guess what? If they're waiting for the feds, which is all part of the U.S. government, to affirm the integrity of this drug, then why in the world did the administration decide that this drug is so important that we're going to go ahead and include it in the cost of Medicare, which has not made a coverage determination yet? That's going to happen a year from now. And yet they're going to go ahead and do that when their own government is investigating if it had any integrity whatsoever in the studies that led to its rapid approval in the first place. That's just crazy. Blue Cross and Blue Shield won't offer the insurance to 𝗰𝗋𝗋, citing how, among other things, the clinical benefit has not been established. All 6 affiliates are located in the populous states like New York, Florida, and Pennsylvania. Lots of Alzheimer's folks in those areas. They said it's just not shown that it's got a clinical benefit. And on Thursday, executives from the country's biggest commercial health insurer, United Health Group, which I used to work for back in the 90s, said that it could take a while before they iron out 𝗰𝗋𝗋 coverage. Why? They're waiting on guidance from Medicare. Interesting. The government insurance program for people age 65 or over. I think this has some way to go before we get clarity. So I wouldn't guide you to expect a very rapid decision making on this, said Andrew Whitty, United Health's CEO, on a conference call with analysts. Everybody's waiting on Medicare. So where's the money going to come from? It's going to come from you, folks. If you would just take 1 second, I've got the good news coming. Now that's the bad news, that they've been conspiring to get this thing done. At least that's what launched this study by the OIG. If you'll take just a second while you're here, please like this video. That really helps the YouTube algorithm to have other people watch our stuff and maybe learn something. At the very end, stick around. Good news is coming here in a second. And at the end, I'm going to show you how seniors can save money in 2022. I don't want to tell you just what's going on in the news. I want to put it in perspective as it pertains to you, how we got here, maybe how we can influence where we're going, and then at the end, how you can save money and actually take action. Thanks for doing that. And if you didn't hit the subscribe, the bell thing up there, that way it'll tell you when we're going live on these things. So let's talk about what was announced this year. We know that Social Security had a big increase, right? Cost of living adjustment based on inflation. And we also know that the Part B costs have just been announced to be higher than ever before. Both are two big things that just happened. A lot of people have commented. Actually, I was up all day Saturday and Sunday and Monday approving hundreds and hundreds of comments on the live stream that I did on Saturday. Saturday morning, talking about this having dropped Friday night. And a lot of people were saying, there goes our increase. They give it and they take it away. So I want to talk to you about the hold harmless provision. This is something interesting I'll just share with you, and I won't spend a lot of time on it. Won't make a big deal about it, nothing like that. But there are a lot of people on YouTube that give it information and then advice, and they help you enroll in a Medicare insurance plan. I just waited until over the weekend until all the other of our friends and folks that do YouTube stuff, they talked about the Part B rate because it came out on Friday night. And many of them are watching this. You'll see that when you watch this over again, this is funny. You'll see on my video, you'll see likes. And for right now, you'll see dislikes. YouTube's talking about taking those away. On the dislikes, those are my friends that also have competing YouTube channels. It's funny. So that's how many people have been disliking it. Really quick, don't want to get off topic here. I waited to see if any of those folks are going to do anything more than just report what the cost is, what the Part B numbers are that came out. They didn't. They just stayed right there. So now I'm going to put it in perspective for you. And how does this really apply to you? Because this is the critically important part. If you're watching this video now, please share this with somebody who's freaking out about the news and the other folks on YouTube who just talked about the increase, because this is how it really pertains to you. So the hold harmless provision, it's not really called that. It's a section of the Social Security Code. I'll give you the link for it here and below. It's going to protect you. Okay, it really is. You may not feel the entire brunt of this increase on your Part B premium. I'll share with you who this applies to and who it doesn't. But again, you will have heard, just like the Part B increase, you heard that first from me on Saturday morning. I guarantee it because it wasn't on YouTube. You'll hear this part first here, and then you'll see other people following this. Follow the leader. Okay, the hold harmless provision to qualify for this. And what this says basically is they're going to give you a Social Security increase. Then they're going to raise your Part B premium, right? They're not going to take your Part B premium so high that it makes your Social Security benefit go negative. So they're not going to take away all your Social Security increase and then make it go less than what it would have been before. That's not going to happen. If you're one of these folks, if you qualify by, one of two things have to have happened. One, you've already been on Social Security income. You're drawing from Social Security. Some people do this at 62. Some people defer and wait till 70. But if you've already been on Social Security income, you're getting that direct deposit every month, then that's one good part, right? You're getting the direct deposit, so this qualifies for you. It's not going to hit you as hard. This has to have happened, already been in place. Now, it's interesting that ironically, they will tell you what the Part B premium is, so you can't make a decision based on what it's going to be. You have to already have been taking Social Security direct deposits in November and December for this to apply to you, okay? So if you've already been on Social Security, this is no problem for you. Also, to qualify, have your Medicare Part B premiums for December and January deducted from your Social Security benefits. It has to continue to move forward into the new year. So we have people from time to time, and this happened twice in the last month that I know of, They were not taking their Social Security income. That's fine. They're deferring. That's good strategy because they're still working in many cases. But they're paying their Medicare Part B premium quarterly. Bad idea. You should go to mymedicare.gov. If you're one of those people paying a check, writing a check and sending it into the government every quarter, you really should go to mymedicare.gov and select that you want it to come out of your checking account. Why? Because you won't miss a payment like two of our people did, thinking that they're just going to get it in there. Maybe it got lost in the mail. Maybe your mail carrier stole it. Maybe they whitewashed your checks. Whatever happened, it did not get to your account. And so they suspended these folks Part B. That's a big problem. So the one way to avoid that is get on the direct deposit, have them come out of your checking account. Same thing you should do with all health insurance related things. It should come from direct deposit, but I digress. A lot of tips we give to our clients, and sometimes I just want to repeat them here in public. Exceptions. Now, the hold harmless provision will not protect you if you've enrolled in Part B and you've not yet made it a full year on Medicare. That stinks. You pay an income-related monthly adjustment amount. So that means IRMA. You're paying for IRMA. Last year was $85,000. You're earning more than that, or you did 2 years ago. This year it's $90,000. Or as a couple, I forgot what the exact number is. I'll post it in the links below. But if IRMA applies to you, which means they consider you a high earner and they want you to pay more, then you're not protected by the hold harmless provision. Of course, they just want you to continue to pay more. And the last one, if you're dual eligible, which means you're eligible both for Medicare and Medicaid, there are special plans available for you, by the way, which we know about, and you have your premium paid for Part B by a state agency, like a state Medicaid. If any of these apply to you, unfortunately, the hold harmless provision does not protect you. So let me give you some examples here, just some math. So let's say that the 5.9% increase is what everybody's getting, which is true. That's great, happening starting in next year. So the average benefit for somebody on Social Security, according to the Social Security Department, my chair is attacking me right now. The average $1,565 a month is going to go to $1,657. Wonderful, a $92 increase, right? But the Part B of Medicare is going up $2,160. According to the government, you're fine. You're still. This is for the average person now. It's only going to take 1/3 of your increase. So now you'll still be in a positive of $70.40. Now, that doesn't take into account, of course, what's happening with inflation, as we covered. Inflation's already over 6%, way higher when it comes to gas or food. But according to the government, the hold harmless provision is not kicking in to protect you yet if you're an average Social Security recipient, because the increase of the cost in Part B has not outweighed the benefit of your Social Security increase. So your net still positive. It's not going to take away and go negative into your Social Security income. However, let's look at somebody with a low benefit. We get these calls all the time. Some lady will tell us, and this is typically what we're seeing, she's making $900 or she's making $1,000 on her Social Security income. And she's saying, what in the world am I going to be able to do with my Medicare premium now? We're getting all these calls. And this is how it impacts you. If, let's say, you're getting a $1,000 benefit, and now because of the 5.9% increase, you're going to $1,059. Your Part B cost was $148.50, just like everybody else. It's now gone to $170.10 for January. That's a $21.60 increase. This would result in your monthly. Now, if they just took this away from you, then your increase could go down. But the hold harmless provision will limit that to $1,059. So you're still going to be positive. It's not going to go negative in your Social Security. And my typo might have been on that screen. The bad news is it is bad. The good news is it's not going to go negative in your Social Security. Just keep that in mind. Even if you're a low income earner, this is not going to negatively make you go down in what you were earning in Social Security. That's the bottom line. I have some links about the hold harmless provision and everything. If I went too fast, of course, you can back up and watch it again, but there will be links below to some studies. And this is what USA Today said about this. And so while Medicare Part B hikes won't take seniors' entire Social Security raise, the remainder of that increase will no doubt be eaten up by higher gas, grocery, and utility costs. Now, I mentioned that at the end of this, which we're almost to, I've got some ways that you can save money. And one of these talks about two of these things right here: food and gas that you can save money on. We're doing it as a family. I just figured I'd share with you because I care about our people. One of the ways you can save money, you might say that this is a sales pitch. It's not. I get paid either way. I'm just sharing with you what we've done this week for people in my office. I went and talked to 3 of our people that were not on the phone at the moment. I talked to Brooke. She sits right outside my door. She's awesome. I said, Brooke, give me the latest recent example of how you help somebody. And I remember this because she sent out a message. She was so happy to everybody the other day. She had a client recently who was paying $237.74 on their Medicare Supplement Plan G. Now that person is paying $138.17 because Brooke helped her. That's a $99.50 per month savings. Guess what? She still has a Medicare supplement just like before. No doctor network, any hospital in the country, go anywhere you want. What your doctor says is approved, as long as it's approved by Medicare. You have no network restriction, no prior authorization, no referrals required. Go anywhere and get anything done right away that you need done with no one telling you no. All that stayed the same. What's changed, though, is now that she has almost $1,200 a year back in her bank account for that same freedom. Why? Because she called Brooke. So I'm going to give you another example. These are real examples. And if you've not looked at your Medicare supplement plan, and it's been over 18 months, a lot of newer carriers with some serious backing that we know about from coast to coast, they're available. And I want to share with you how you can take advantage of that. This is Alexis. Alexis shared with me a recent thing that she just did for somebody who was paying $153 a month. Now they're paying $87.21 a month. It's $65 a month. That's this client's money. And guess what? The benefits are the same freedom, same flexibility and everything. So that's $789 back in this senior's pocket. That will far and away take away the difference on the Part B increase because these clients chose to work with my office. I think that's a pretty cool thing. If you don't know how to reach us, I'm going to give you some links in a minute, but you can look up there, seniorssavingsnetwork.org. One last example, and these are real examples from real clients that just happened. This is Gabby. Gabby had somebody that was new to Medicare, shopping around, trying to figure out what they should do. They called another agency and they were told I won't tell the name of the brand. They were given a price for Plan N. They learned about Plan N on my YouTube channel. They were giving a price of $151 per month. My sneaking suspicion, knowing how this industry works, is that the agent was going to get a bonus for writing this new particular plan, but I'll leave that to my own. Gabby just looked on our quote engine and found a really good company that we write a lot of right now because they're really, really good with their rate increases and their initial rate. Same plan, same benefits, same everything for $126 a month. That's a monthly savings of what she would have done without Gabby. And guess what? Somebody always says, well, how do you get paid if I shop my insurance through you? I made a website for that. And I think it's called howdoyougetpaid.com. You should check that out. Howdoyougetpaid.com. And you've got a video of me explaining how do you get paid when you're doing insurance for people. The bottom line is it's the same way as your car insurance or your home insurance. They get paid because they're your agent now. And a portion of every insurance policy written anywhere in America has a part of that that goes toward the agent. So if we write it, or if you go directly to the company, you get the same rate if you had the kind of information that we have, which most people don't. And somebody wrote the other day a comment on a video that said, you can just go to Medicare.gov and find your Medicare supplement. No, you can't. Have you ever gone to Medicare.gov and tried to find a Medicare supplement? They'll show you a list of companies that are available in your state, and they want you to call all of them, 60 of them, 80 of them, whatever, and get a quote, get a quote, get a quote, get a quote. Meanwhile, we have it on one screen, and our service costs absolutely nothing. We save people money when they call us. This person saved $300 a year simply because they had the fortitude to call in here from something they learned on the internet and let us help them. I'm going to share with you 1, 2, 3 links that are right over here that'll really help. If you're already on a Medicare supplement and you know that you want to get a Medicare supplement, you can find out with a map what happened there. You can find out at seniorssavingsnetwork.org. That's our website. And you can skip to it if you put what do they call that? / underwritten, because you'll have to be underwritten. There I go through what the health questions are, what states this applies to you at, how to reach us if you can go through the health questions and you say, you know what, I think I can qualify. The biggest question we get in comments all the time on YouTube is, I don't know if I can qualify or not. How do I know? Well, typically in years past, we would have you call in, we would go through the health questions and see if you qualify. Then we would look at the quote engine, then we would help you with the plan. Now I've automated that. I put the health questions right there on this page. So you can save time and phone tag going back and forth by just going to this website, seniorssavingsnetwork.org/underwritten, and you can see what's involved in the underwriting yourself. And you can even book an appointment with us that's convenient for you so you can avoid the phone tag. That's helped a lot. We also made one, Robert, our tech genius that's in the other room, for open enrollment people. And this is the real open enrollment, not what they're calling the annual enrollment period. Let's say you're brand new to Medicare. You're brand new to Medicare and you're going to start Part B. If you don't know how to start Part B, I can help you with that too, because I made a website called howtostartmedicare.com. Isn't that ironic? Howtostartmedicare.com. And there I have a video and the links on how to start Medicare, whether you're just starting Medicare because you're turning 65, whether you're losing employer insurance and you don't know what to do. I've got the link in the forms there. No matter what you're doing on trying to start Medicare, howtostartmedicare.com has you covered. But let's say that you are going to start Part B for the first time, either whatever reason, you're brand new in the country, you're losing an employer plan, whatever. You can go to seniorssavingsnetwork.org/open enrollment. You can book a time with our specialists in my office that are right outside my door that I work with every single day. And you can skip through having to call in and book a time and waiting and questions. Everything's right there. So easy now. And then let's say you're one of our thousands of clients, that we have clients in 46 states across the country, and it's time for you to renew your plan. We reach out to all of our clients with a voicemail, with an email, and then we try to get them on the phone if we can. But everybody wants to do this all for January. So I would ask you this. If you're an existing client with us, please use the link that's down there, seniorssavingsnetwork.org/renewal. And when you do that, you can get on our calendar and we can look at all available options for our existing clients only. So either underwritten if you're not an existing client, but you're on a Medicare supplement and you want to look at another one, where we The next thing is just something that my family's been saving a lot of money on. Gas has gone through the roof, and this app is now automatic with all of our family members. The other day I was at a place and saved 22 cents per gallon. That is significant. That's big time. And now they also have restaurants on there. Your local restaurants, depends on your city, of course, but in our city, they have 3 restaurants and they're getting more. And I can save, and one of them, 20% off of my restaurant bill, just if the live stream keeps cutting out. No, not just you. And let's see. Take it to the end here. So these are our folks. We're available to help you with your Medicare insurance if you're looking at an Advantage plan. I should have put some of our other links on there. Like if you want to compare your drug plan before December 7th, which is the last day you can compare your drug plan, it doesn't matter what drug plan you had for 2021. Please don't make the mistake of thinking that exactly what you had in 2021 is going to be the exact thing you're going to have in 2022. You're going to go hands off. A study from the Kaiser Family Foundation found that overwhelmingly, over 90% of people don't do a thing with their Medicare plan. They just let it renew. You're going to be in for some serious sticker shock if you do that on your drug plan this year for most people. You can go to startpartd.com, startpartd.com. And if you do, you'll be able to see the drug plans. And startpartd.com is another way that you can save money and do it yourself. You don't need to meet with an agent. You don't need to fill out any forms. You can put in your drugs and you can tell exactly what the cost will be for next year. Save on Part D. It expires December 7th, unless you're new to Medicare. December 7th at midnight exactly is when the drug plans have to be done by. And you have to have that thing done by December 7th at midnight. StartPartD.com is another way you can save money. Please just compare what the plans are. And if you do want to apply, it'll take you straight to the carrier site with your information already halfway done, because the plan that you picked, you can enroll without having to talk to anybody. How easy is that? Last year we had 600 or 700 people that took advantage of this because I put it out during the annual enrollment period. This year, we're already there and far past it. So this is a tool that anybody can use. I promise you it's simple. It's even easier than Medicare.gov, where a lot of people go, and you won't get the follow-up phone calls from people trying to sell you stuff. So I'm going to look at some questions that we have here, and I apologize for it cutting out. I promise you I had nothing to do with that. Here's our phone number if you want to call, but with those links that I put out before, that's the best way to reach us because you can skip all the phone tree stuff, which we're trying to do our very best to call everybody out, call them back as best we can. Let's see here. I'm going to go back and see what the folks had to say here. Bill's on here. Oh, wow. That's a cool name. Apprendio. He's a Medicare agent. That's cool. We get a lot of Medicare folks watching. Let's see. Thanks for bringing up the updates. They're hiking up things because they can. Man, there was a drug, 𝗰𝗹𝗹, I think it was, that the FDA said showed some serious benefit for people on Alzheimer's, and they were doing a study for it. I'll have to do another video on that. And the study showed significant improvement with people on Alzheimer's. And all of a sudden, for some reason, the drug company stopped all the trials on that. It was an off-label use of the drug. And someone put that in a comment on my YouTube channel. I appreciate you doing that. And I found the study about that. Absolutely incredible. I replied to that comment on YouTube on our channel, and I put that link to that study on there. Amazing stuff, how the drug companies are, apparently, it looks like, maybe, in it for nothing but the profit. Shuri says, good reports about coconut oil. Interesting. News always on Friday. How many people are gone the week of Thanksgiving? We're working overtime. Our people are coming in early, they're working late, and they're working 6 days a week to try to help as many people as we can. That's why I think it's critically important that if you can, use our links to get on the schedule. You can see what our schedule is right ahead of time and not have to go back and forth on the phone calls. Janie, thank you so much. You're sharing our information with people. James, I appreciate you so much. I see your comments and letting people know things that they should know. Interesting here, Jacob. Why aren't the working bearing the cost just as we did when we were working? The only way to survive when you're too old to work is give up everything, go on Medicaid, and hope for the best. Gosh. James says, I carry a business card of my agent to give out. My fellow seniors going on Medicare are bombarded with Medicare Advantage plans. Let's see. It's interesting. They've not even approved the drug, and yet they're making you pay for it. That's my biggest complaint about it. And then showing that even the big industry places like Cleveland Clinic and Mount Sinai, all the reasons for not covering this drug, and yet Medicare can't make a determination on whether they're going to cover it or not. Cover it, and that's fine. Y'all do your thing. And the Office of Inspector General report is still, the investigation is still underway right now, and yet Medicare says, let's just bump up their Part B premium in case we have to cover this drug. The FDA is nothing but pharmaceutical companies that are looking out for their interest, and money is not for the safety of the people. Ashley, that's interesting. Did not know that. Yeah, that would be interesting. Texas Gunslinger. I love that badge. The 5-point star. Follow the money. Which U.S. congressman has invested in Biogen? Interesting, right? It's interesting that members of the Federal Reserve have been called to task recently because they were investing in companies right before or getting out of the companies right before they make a federal determination as to what they're going to do with interest rates and so forth. Absolutely interesting. And then direct deposit, a good idea. It really, really is. And a lot of people, and they always say, why should I let an insurance company into my bank account? If it's for medical insurance, it's a good idea. Watch it every month. Watch it like a hawk, and you can dispute it with your bank if they get it wrong, but we don't see that going wrong. What we see is people who insist on sending in a money order, like a gentleman did yesterday, told me. He sent a money order into an insurance company. They never got it. They never credited it to his account. And then they lost it. They stopped his policy altogether. and they're making him prove that he had a copy of a money order that he mailed in. Let's skip all that so we don't have you losing your coverage and tie up a customer service person trying to help. We can sign up with direct deposit for your premium just on the health insurance. Maybe not your electric bill, maybe not your water bill, but on your health insurance. It's critically important that you don't miss a notice that they didn't get it. Wow. My wife is watching and opined. Funny how insurance agents, as part of our continuing education, which she's doing right now, are required to take an ethics course when the government should be taking it too. Isn't that interesting? What about underwriting? Yes, I got that covered at seniorsavingsnetwork.org/underwritten. You're going to be underwritten so we can handle that. Sandy said, Alexis is awesome. That's the truth. I thought you can't switch from one Medigap to another easily. We can. Yeah, I'm sure a lot of agents would like to tell you that, but we can, and we can show you how that process works. Do you only sell Medicare insurance? No, we do life insurance too. And I mentioned in my annual update video, which you can see at youtube.com/Senior Savings Network. We mentioned that we do life insurance too. So we've had a lot of life insurance cases coming through, but we pretty much do everything that happens with seniors. Medicare should have an do not advertise or an opt out. That's the truth. Absolutely right. What would Jimmy J.J. Walker do? Probably make another commercial if they'll pay him and bring him out of obscurity. Bless his heart. This is interesting. Yes. How to cancel Obamacare when starting Medicare to avoid getting a premium subsidy. Now, there's been a lot of news about that lately. And the Obamacare folks, as you know, with the last COVID bill, there's a huge amount of subsidies going to people who are on Obamacare, and they've increased the income limits for getting help with your premiums for Obamacare, the Affordable Care Act. And so for a lot of people who couldn't afford it before, they can now, and now they're in their open enrollment period again. I would say that if you're coming on to Medicare and you've been enjoying a subsidy, which means your premium is now affordable. If it's affordable, you're getting a subsidy, because when it's not affordable at all. If you're getting a subsidy and you turn 65 and you're eligible for Medicare, it will catch up to you and they will want that subsidy money back. You need to start Medicare unless you're working for an employer group plan of 20 lives or more. If you're working for an employer group plan of 20 lives or more, you can hold off. You don't have to do it right now. If you're not, and you're just an individual on individual coverage, you really need to start your Part B so you don't get a penalty and so you don't get the bill for all that subsidy money back. And Mr. California said, I get 7 Advantage Care mailers a week. Millions and millions and millions of folks are getting those in the mail. And it just makes you wonder, where is that advertising money coming from? Thanks, Rick. Hannah shared with me a text that we got from one of our clients this morning that they were out for a walk and they did not see any deer, like I did on my live stream walk the other day. Bill said, do you think that this new drug will bring up the cost of supplements? No, I don't think so. This is a Part B administered drug, and Part B administered drugs are all the drugs that are given in the doctor's office. So it does have the potential of possibly doing that. However, Medicare would bear the huge brunt of it. And if one of the good things that this administration is proposing is to negotiate with the pharmaceutical companies, I think we're going to see the price of this drug, if it does ultimately win real approval with Medicare, the cost to come way, way down. That would be a good thing. But the other thing that's important to remember is people who get on a Medicare Advantage plan will always be under the impression left either by a mailer or a J.J. Walker commercial or another insurance agent that's trying to sell them that Medicare Advantage plan. They don't know that the Part B administered drugs are still paid entirely by them. Most people don't know that. So if you look at chemotherapy drugs, you look at this drug, you look at Prolia, you look at the other kind of osteoporosis drugs administered in the doctor's office, 9 times out of 10, they're going to pass that cost right on to the senior if they're on Medicare Advantage. So you're going to pay 20% of that drug's cost right out of your pocket on an Advantage plan, where on a supplement, you would not. On Plan N, you'd have a doctor's office copay up to $20. Woo! On Plan G, you'd pay nothing for a Part B administered drug. So that's just an interesting aside. Is it advisable to get a Plan D as opposed to separate insurance? Plan D is Medicare Supplement Plan D, which is kind of an obscure plan that many companies tried to bring back after MACRA happened January 1 of 2020. It was not found with, most people did not receive it at all. I think that's mostly because, and what might be happening here, a lot of people confuse Plan D with Part D. Part D of Medicare is one of the big components of Medicare. Part A, hospital. Part B, outpatient. Part D, drug plans. And if we're talking about drug plans, if you are not on a group plan with credible drug plan coverage, yes, I think it's a good idea to get a drug plan to hold your place. And now, if you're watching this from October 15th through December 7th, during the annual enrollment period, is the time that you sign up for a drug plan. If you didn't have one before, yes, I think you should get one, because later on, if you need some drugs that are tier 3, tier 4, tier 5, those are the expensive drugs, and you don't have a plan as a backstop to help you with those out-of-pocket costs, it could cost you a fortune. And just trying to get on a drug plan later, if you didn't have one, means you have to wait till the next annual enrollment period for the next January to kick in. And then you have a penalty for 1% of the national average drug plan cost, 1% of that national cost for the rest of your life, for every month. So if you were out for 5 years without a drug plan, and then at age 70, let's say you decide to get a drug plan, you're going to have a 60% penalty added to your premium, 60% of the national average drug plan premium price, 60% premium added to your monthly premium as a penalty that lasts the rest of your life. So for that, if you're asking about Part D, I think it's a good thing to have, unless you have group coverage that's qualifying coverage. Let's see. Sandy said, I would love to know why COPD medicine is out of reach for people who have COPD and can't afford it. We have had a lot of people who've gone back to their doctor. We talk about this every year when we're doing drug plan reviews for our clients, and try to find out if there's a generic alternative, and try to find out what the cost benefits would be if you can tolerate the less expensive, the generic versions of those drugs. It's a conversation we have to have with our doctors to see what is affordable. What can we do as a group to potentially change or make aware? I've failed on this. I've always been fully transparent. I'll share with you now what I screwed up on this weekend. Our daughter, Casey, who is 16 years old, asked her mom and I to take her downtown to downtown Charleston, which is a beautiful place to hang out. And as we're walking around for a couple hours, got a lot of exercise, got sun, got out of the office, which was great. This was on Sunday. And right in front of me, lo and behold, is our senator from our state, Tim Scott. And he is visiting Charleston. He has a business here and everything. And he's standing there with two members of what I believe to be U.S. Capitol Police, his security detail. And now my mouse is frozen. That's Nate, not my wife, my mouse. So he's standing there, and now the Medicare thing had just come out Friday night. He had just been a signatory on a letter to CMS talking about, please don't mess with Medicare Advantage. Please let it stay the same and all that. That's great. I wanted to talk to him about the Part B increase, but it's Sunday. He was off duty, as it were. He's just trying to recreate just like I was. So I took a selfie with him behind me, but I did not approach him. A lot of other people will run up and tell all their grievances about the United States and be crazy and all that stuff. But I missed my opportunity. It was not like he was holding a town hall and having people come and share. We do have that opportunity once a year. It's part of the National Association of Health Underwriters that I'm with. They do go to Washington every year and talk about trying to advocate for seniors, and I'm a part of that organization. But I just didn't feel like it was the right time or the place to approach Senator Tim Scott to talk about that. But we do need to get our Congress people involved in this. And I think right now, while it's hot, is the time to reach out and let them know. Sandy, thank you so much, giving out our name and number on there. I'm going to end this as soon as the viewers drop down, but they have not yet. So I'm going to continue answering questions. I started a Medicare supplement plan on June 1st. Should I shop now for another plan or wait till May? Their premium is going up $5 per month. I'm not sure which plan you're on, Jackie, but all the premiums on all the companies that we write don't go up during your first year. There's a 1-year rate lock. So your premium should not be going up 6 months into your plan. Not at all. So typically you would want to shop 30 days before your renewal if you know that you're getting a rate increase. If you're with one of our plans and we did this for you, you're probably not getting a rate increase, or if you are, it's 1 or 2%. Because we pick our carriers very carefully. We don't just write everybody in the market, although we could. We're very selective about who we write. And like I said, the carriers that we write would not give you a rate increase 6 months into being on a new plan. If I were you, I would let us look at this for you. Not sure what state you're in, and I'll try to pull it up later if you answered that. But if you'll go to that link up there called Senior Savings Network /underwritten, we can look at that for you. Because if you went with another agent, we're probably able to save you money anyway. I'm just being transparent with you. Check out Christine Brady, heads the NIH. Oh, isn't that interesting? I'll try not to get conspiratorial because we've got our own opinions on those too. Yes. If you pay your Part B manually online, not every month, but manually online through mymedicare.gov, you can use a credit card, but you can only use a credit card for one shot each time. So if you manually go there every month or every quarter and you pay that premium using a one-time payment option right now with Medicare, you can use a credit card. But to set it up on, don't ever worry about it, don't ever think about it again, direct deposit from your checking account, then you can't use a credit card. But it does say on Medicare.gov that they're trying to work on that and get that in there. The reason why they don't do it, I can just tell you, is because credit cards inevitably will have a cancellation date and expiration date, and they don't have the mechanism at Medicare to reach out to the Medicare beneficiary and say, your credit card's expiring, you need to come on Medicare.gov or mymedicare.gov and change your credit card expiration date. That's why they don't let it happen for ongoing monthly payments right now. Oh, my wife, Nicole, said it was Saturday, not Sunday, that we saw him. #fact check, she said. They say to call the last day of the month, but that sounds risky. I do have Medicare all set for 12/1. Awesome. Now, the last day of the month is an interesting thing too. If you are changing things on your Medicare plan, incidentally, we have another period coming up right after this annual enrollment period. It's called the disenrollment period in my mind, because that's the accurate term for it. Medicare is going to call it the open enrollment period. It's the furthest thing from open that there is. It starts January 1 through March 31st every year. And they brought this back because so many people were signing up based on Dr. J.J. Walker telling you what you should do or their health insurance, for example, or Captain Kirk, or some other famous ex-football player telling you what you should do with your health and health insurance. They're finally getting the summary of benefits, sometime in early January or late December, and going, what in the world did I sign up for? So this period, the disenrollment period, starts January 1st. It's really weird how Medicare works. We have a blackout time from December 8th when the annual enrollment period's over. That's the night that I will have woken up for my birthday party, which is December 7th, Pearl Harbor Day, the last day of Medicare. We all celebrate, right? December 8th until December 31st, you can't do anything with Medicare. Nothing. January 1, it starts over again. January 1 to March 31, you can drop or change your Medicare Advantage plan again. So if you're feeling like, oh my gosh, I'm on this Medicare Advantage plan, I don't know what to do, all the agents are busy, no one can help me, no one's calling me back, I want to get underwritten, I want to get over to a Medicare supplement, we still have time. We have January 1 through March 31, and it's a much better time of the year because we don't have every single one of our clients trying to get in for a review. So January 1 to March 31, if you're on an Advantage plan and you'd like to look at a better one, or you'd like to drop yours and go back to original Medicare, don't do that unless you're approved for another insurance. We can help you with that. So if you go to seniorsavingsnetwork.org, and at the top where it says Medicare help, I've got a whole video explaining that process. It's called How to Go from Medicare Advantage to a Medicare Supplement, and we talk about those times of the year. But don't fret if December 7th. Oh, the reason about the end of the month. Anything you do during those periods, like the open enrollment period, they call it, the disenrollment period, January through March, anything that you do during that period will take effect on the first of the next month. So if we get to your plan and we do an enrollment for you during January, it'll kick in February 1st. Anything you do with Medicare takes effect on the first of the next month, except for AEP, which is January 1. Topaz says that the penalty is $33. That's the average annual premium. I've not looked at that in a couple of months now. Average annual premium for Part D if you didn't have one. So it'd be 1% for every month that you didn't have a drug plan when you go get one finally. 1% of $33, if that's the accurate annual average. Okay, I want to stop my Medicare Advantage plan and switch to original Medicare plus a supplement and Part D, not Plan D, but I digress. Possible or not, I've heard both. It's absolutely possible. I would highly encourage you to go to, I just mentioned, seniorssavingsnetwork.org. Go to the top where it says Medicare Help. And on there, you've got a menu. I want to go from Medicare Advantage to supplement. And I chronicle there with great graphics that took a whole day and a half to work on what the process is and what the steps are and how the underwritten process works there. So you can see that. You either have until December 7th to do that, or as I just mentioned, you have another period starts January 1 to March 31 where you can do that as well. Thanks for the question. Marlise, that's a pretty name. My husband says he doesn't have Part B. Would we still use the underwritten website to contact you to get one set up? No. If you don't have Part B and you want to start Part B, the best thing to do is go to howtostartmedicare.com. howtostartmedicare.com. If you go there, you will see a video that I shot at the beginning month of the COVID thing. We were stuck in, we just bought an RV. We just went to Dallas, Texas or Houston to pick it up, drove it all the way home, and then everything locked down. So we were stuck at the KOA campground trying out our new RV. And I did this video out there by the lakefront with long ratty hair because my wife did not cut my hair yet back then. Now she does ever since that time. But anyway, howtostartmedicare.com has the forms to get on Part B or the link to get it from socialsecurity.gov. And then you'll be open enrollment. So I would use the open enrollment link that you see right there, open enrollment. It says when you're new to Part B, regardless of age, when you're new to Part B or you're going to be, you can secure a Medicare supplement plan 6 months before that Part B starts. It's really cool. I know a lot of people are saying, especially agents who don't know the deal, don't know the difference because all they do is Medicare Advantage. They're saying 3 months on one side, 3 months on the other side. And the month in the middle is when you can do Medicare Advantage. And that's true. Medicare supplement is much bigger than that. You have 6 months before your Part B starts. You can lock in a Medicare supplement rate based on today's rate. And then 6 months after your Part B starts, that entire period of time, and it's effective immediately on the day you apply, you can get a Medicare supplement with no health questions whatsoever. Completely open enrollment. That is called your initial election period. Someone asked an interesting question, an agent did the other day, because we have a lot of agents on MedicareAgentTraining.com, where we have over 3,000 agents that are subscribed to learn how to do what we do, which is help seniors across the country over the phone with Medicare. An agent wrote in a question and said, I have a person who went back to work, gained full employment again at a company over 20 employees, so he doesn't need his Part B. Can he cancel his Part B or suspend it for a time? The answer is yes, you can suspend your Part B if you've returned to work. It does typically require that you go into the office of the Social Security office. Now, yours may be still closed due to COVID, but they want an in-person interview with you to go over making sure you understand what you're giving up when you're giving up your Part B, but you can suspend it. If then you retire again and you want to come back to Part B and Medicare, you can apply again. No problem at all. You'll have to show proof of your qualifying coverage during the lapse period. We've got that form on howtostartmedicare.com. And then you get what's called IEP2, your initial election period 2. And that's the code that we use. We can help you with all that. But yeah, that would be seniorssavingsnetwork.org/open enrollment. And we can get you set up and look at all the available plan options for you, even before you apply for Part B. And we can help you through that process. We do it every day. Let's see. I skipped year 1. I think that was talking about the Part D plan. Can a person go with you even if they've already used another agent previously? All day, every day, we help people undo what they got. And to be frank with you, and I hate when people say that to preface things, the biggest problem we have are people who get a mailer and they go with the largest insurance company thinking that they're going to advocate for them. Typically, if they'll have less than 6 characters in their name and they're an acronym, they'll just get the largest things. Well, apparently this is a consumer advocacy organization. It's going to save me money. Really? Let's take a look at that. And that would be an example that we showed earlier from, I think it was Gabby. They got a call from somebody who was going to charge them a lot more for the same thing. And let's see. Absolutely. Yeah, that would be going to seniorssavingsnetwork.org/underwritten. So we can see your propensity, your availability of changing to another company, and then you can book a time with us. We do that all the time. Jackie is with Ascendo. Thank you so much. AARP increases in July, I believe. What to do with Medicare if you want to live in another country for a year or two? Well, I would strongly recommend that you keep it. If you have a Medicare supplement like we write, you also have out-of-country coverage, not a problem. The details of that, you can find it at medicare.gov, leaving the country, or you can go to Google and say medicare.gov/country, and it'll show you what the coverage is if you're leaving the country on the Medicare supplement. But if you give up your supplement and you come back in the country, you're going to have to go through underwriting again to get it. If you come back in the country and you want an Advantage plan, no problem. You can get an Advantage plan, or if you get out of prison, that kind of thing. But I would keep your Medicare, even if you're out of the country. I really would. We're looking at some countries now we could go to later on when I'm completely retired. And we deal with people like that all the time, and they want to keep it. Is it still going to work for them? Yes, especially the supplements that we write. Let's see. Last day of the month to cancel Obamacare. I'm afraid they sent out a premium subsidy in December, and I don't want to have to repay that. Yeah, I get that. Why is it that when I talk to Robert, you don't use the Medicare website for Part D, where it would clearly show more options? You're absolutely right, Sandy. We don't use Medicare.gov because it has been documented by CMS for the last 2 years. Medicare.gov was not accurate. As a matter of fact, Medicare quietly, and I covered this on my YouTube channel, gave people a special election period to get off of their drug plan if they relied on Medicare.gov to get their drug plan. And the numbers were completely skewed from reality when they actually went to use it. So our system, we know, is 100% accurate. Now, why don't we have every drug plan in the country? It's the same reason why we don't have every Medicare supplement plan in the country, because some of them we've chosen for our internal reasons, doing due diligence, are not worth us offering to our people. Like, I don't want to tell my mom, hey, mom, go to startpartd.com. And she says, hey, I chose this plan. It's so tiny, I can never get anybody on the phone. They're not covering anything. I can't get a prior authorization thing done. I can't get any decision made on an out-of-pharmacy drug done. Why is that? What's the problem? I'll say, well, yep, you chose any plan that's out there. It's available to you. However, I wouldn't have recommended you go with that plan. Well, then why do you have it on your website? Exactly. So I don't want to have every option open. We have what's open are the plans that we have done our research and found that they are good plans for our people. Now, in Medicare Advantage, you're not supposed to say, this plan's good, that plan's bad, this plan is the best, this plan is the worst. So we keep our opinion out of it. I will tell you that the reason why you're seeing a limited, finite number of carriers available on startpartd.com is that reason. Yep. If I just left a loading gun around, somebody would pick it up and hurt themselves with it. And we don't want people signing up for a company that we've done due diligence on and we don't recommend them. Agents ask me all the time, hey, how come you don't have brand new Carrier X? It just started yesterday. They're paying an agent bonus of $300 per application. Why don't we have them? Because we checked them out when they filed their insurance paperwork, and we find out that they're junk. They have a third-party administrator that doesn't take care of people. We know their history. They're not backed by an A or A+ rated carrier in the background or their reinsurance. And we know who's administering that plan. So we don't want to offer that to our clients or our agents. That's why you don't find every insurance company on our agent site or on our client site. It's not just that we're going to offer everything and turn somebody loose on it. So you can consider that somebody did some research on your behalf, and what's shown there is what the result is. Thank you, Tina. Vic says, I've been on high deductible Plan G in New York for a year now, and I'm very happy with it. Many of my procedures I've had were covered in full. That's awesome. That's one of our strategies, Vic, that we're sharing with everybody now publicly. If you're in New York, where you can change from any Medicare supplement to any Medicare supplement and still have the freedom, the flexibility to go anywhere in the country, in New York, because we can use the law to our advantage, we'll put the majority of our people on high deductible Plan G. What that does is it gives them a high deductible, which has gone up again. But if they come down with some kind of illness, something that's going to be a prolonged thing, let's say cancer, God forbid, somebody has cancer with a high deductible Plan G, they can call us on the phone and say, I'm in New York State. I got a high deductible Plan G. I want to have a Plan G. the real Plan G, or Plan F. Depending on your age, you can still get it. If you're eligible for Medicare prior to January 1, 2020, you can always buy a Plan F. Hey, guess what? You're going to go in and out of the doctor, in and out of chemo, in and out of rehab, whatever else. Yeah, let's get you the best plan right now. The only caveat to that in New York is it has to start on the 1st of the next month. So yeah, most of our people in New York are on high deductible Plan G. Why? Because they can bide their time with base level Medicare coverage with a safety net. But if something hits the fan, and this is unique to New York, we can get them a much more comprehensive plan for the duration of that illness and then put them back on the high deductible Plan G. Look, I don't write the rules. I'm just old enough to know the exceptions. Sorry, I know I will be underwritten. That's not a sorry. We have a lot of tools at our disposal. We can probably help. Jim says, I'm 62, just approved for disability. I live in South Carolina. What are my next steps? They enrolled me in Part A and B. South Carolina is unique. South Carolina is unique in that, and every state's different. This is a state law, not a federal thing. Let me put it on here so you can see this. Whoops. On Medicare, if you're under 65, again, it depends on the state, but you do have options, and now is a good time to do it. Under 65 on Medicare due to disability, I made a website for that. Of course I did. It's called Medicare on Disability.com. This will show you the options that we can help with. Medicare on Disability.com. Now, it may be that the only thing you can get, because it is in South Carolina, due to state law, the only thing you can get is a Medicare Advantage plan. However, you can get a PPO plan. We have some really, I can't say really good ones. We have some that I would recommend to people that are in South Carolina based on the fact that I've done my research on them. How about that? That's compliant. So you'll see what those are over here on MedicareOnDisability.com. I will also tell you that if you want to shop for yourself and not have an agent involved and not have to do a scope of appointment, which is a government permission slip, and you want to look at available Medicare Advantage options, which you can do here, you can go to MedicareAdvantageNearMe.com. It's long, but it's pretty easy. MedicareAdvantageNearMe.com. And if I were picking a plan for myself, I would tend toward a PPO plan, because then you have not just a local HMO network that you can take advantage of, but you've got the opportunity to go outside the network if the doctor agrees to build that company. So we're looking for big name brand companies, high rating, high star rating, and a PPO or an out-of-network option with that plan. Yes, we can help with that. If you go to seniorsavingsnetwork.org/open enrollment, we can help you manually with that, but you'll see what those options are state by state across the country on MedicareOnDisability.com. South Carolina is just one of the few states where they do not let you have a Medicare supplement under the age of 65. And that's not a good thing. Do you have customers that reside in New York? Yes, we have thousands of them, I would say. New York. Do we work in Texas? Yes, all over. Matter of fact, my best friend's mom, we're going to call back today. She's in Texas, and we're doing a drug plan review for her. She's our client. Let's see. I was told there is a Humana D that is only $10 and change. I don't take any meds. Humana tells me I have to stick with the program I had last year or get the one with bells and whistles. Jeannie, you bring up a really good point, and this bears repeating. We have 150 people still live on here, so since we have not tanked, I'm going to continue to take your questions. You can put them in the comments of the video where you're watching this, and I'll see them. So, no, that's wrong. That's a salesperson telling you that you have to stick with the plan, trying to do company retention. I understand that. They're trying to keep you in the family. That's one part of it. You can change your drug plan during annual enrollment period, and there are less expensive options everywhere than $10. How do you know that? How do you see that? Go to startpartd.com. Let's see if I can get this to go there. Startpartd.com. Put in your zip code. Look at the drug plans, Part D. And if you're not taking any drugs, you can go, oh, lowest price, enroll me. 5 minutes later, you're done, and you never have to talk to anyone. You might find that it might be a brand that's not Humana. Doesn't matter. You're not taking any drugs. Hold your place with the Part D drug plan is my best advice. Hold your place, look at all the information there, and sign up for a plan that you feel best fits your needs. Now, that said, let me talk about the bells and whistles. This I put in every year's update. For 2020, you can see it. You can see that update for 2022 if you've not yet seen it yet. SeniorSavingsNetwork.org/update, a full run through of what you need to look for this time of year. That's SeniorSavingsNetwork.org/update. You'll see everything. One of the things that are in there that often goes overlooked, and it bears repeating, is if you sign up for a drug plan this year, you're probably going to get a call. And from that company, you're going to get a call. And they're going to say, we're doing something like a quality improvement thing, just checking to make sure you got your questions answered. How is everything with your enrollment? How is your agent? How's all that stuff? Oh, by the way, you only signed up for a drug plan. Did you know you can have an all-in-one plan and the monthly premium is $0? And yeah, you'll have a little bit of network, and you'll have prior authorization, you'll have referrals required, you have to pick a primary care doctor, the doctor can leave the network anytime. They won't tell you those things, but they'll tell you you can have an all-in-one plan called a Medicare Advantage plan. And I think now they're trying to stop using Medicare Advantage because there's a lot of negative connotation with that word, that terminology. But they'll tell you it's an all-in-one or complete or whatever plan. That's called an upsell, and that's what you make reference to here. You have to stick with your plan, which you don't, or get that one with all the bells and whistles. It's great on the one side. What they don't tell you is the negative side. If you want to know what those are, another website I made for that purpose that's easy is called allaboutmedicareadvantage.com. Yes, we help people with Medicare Advantage. I just 5 minutes ago gave out the link where we do that. We can do it through open enrollment. We can do it through MedicareAdvantageNearMe.com, where you can pick your own plan and sign up for it right now, MedicareAdvantageNearMe.com. But we want our people to be fully educated, which is why I have allaboutMedicareAdvantage.com. I've got a whole bunch of videos there that include the Office of Inspector General's report about how they routinely deny care, routinely, all for a profit motive, hoping that people don't appeal, and finally get that thing approved. So watch the other people's stories. I've got a bone doctor on there talking about a knee replacement. What do you call it? I can't remember the name. But it's right up there on top. See what the doctors have to say about it. Make your full informed decision. But that's called an upsell, and you don't have to listen to it. Say, yep, love my plan. Thank you. Hang up the phone. It's going to happen. Is Aon a broker? They are kind of a broker. Aon has, and I covered this years ago when they were doing, was it GE and or AT&T? We'd have these large groups of people who would stop their employment benefits, their retiree benefits for their retirees, and say, just like the city of New York just did, hey, we're going to push you toward one plan. What these companies did is they said, we're going to push you toward one broker. We're going to incentivize the broker a little bit. We're going to have a restricted number of plans that you can sign up for. And I did a whole video about that, showing Aon rates versus our rates. And for whatever reason, and this was 5 years ago, everything that we showed that they were quoting our people was way higher than the same company, same plan that we were quoting our people. So yeah, they are a broker. They just don't have all the plans that we have. But they have different plans, let's put it that way. Something good about New York. Yeah, with the underwriting there, for sure. Francine says, on a Plan F, I can contact change anytime, right? So call you after December. It depends on what state you're in, Francine. No, you can't change anytime. The mere fact that you have Plan F, which you probably shouldn't have, I covered that in 2015 with a website called PlanGisBetter.com. Why? Because every Tom, Dick, and Harry insurance agent was trying to sell people on Plan F. Why? Because it was 20 to 30% higher in premium, which translates to 20 to 30% higher commission for the agent. And it's very simple to say to somebody, hey, just get this Plan F plan. Everything's covered. Sign here. As opposed to explaining the other plans and why, with you absorbing a tiny bit of the cost, like Plan G or Plan N, you save a lot more money than you ever would on Plan F, even the good or the bad scenarios. So I will tell you that probably not a good idea to be on Plan F. You can see PlanGisBetter.com. You can see PlanNMedicare.org, where I go over Plan N. But yeah, if you want to get off of that, that's probably a good idea. And you should, depending on your state, you should look at SeniorSavingsNetwork.org/underwritten. And if you're in a state where underwriting is not an issue, we'll tell you that right there on the map. And then under the map, you can see the text of your state. Click on your state, book a time with us. Be happy to get you off that Plan F. Yeah, we need to tell more people that. Got all my Part D questions answered. That's awesome. Thanks for being here. The local clinic says Plan C is really Medicare alternative. It is. Yeah, so I mentioned before, this Part B increase is affecting everybody on Medicare. Doesn't matter who it is, even if you're on Medicare Advantage. And one of the big problems I have with Medicare Advantage is if you look at my website called allaboutmedicareadvantage.com, you'll see the things that you give up to be on Medicare Advantage. One of those things is the ability to go to any doctor, anywhere, anytime without prior authorization, without a referral. That's what you get with Part B. However, on Medicare Advantage, you don't have access to Part B. You don't have access to go to any doctor, any hospital without a referral, without prior authorization. That's a Part B thing. And yet with Medicare Advantage, you still have to pay for Part B. You have to continue to pay for your Part B, but you don't get the benefits of Part B. So is it an alternative? Yeah. Is it compliant to say that? No. Francine, you're in Michigan, definitely have to go through underwriting. Some good companies we have in Michigan, that would definitely go to seniorsavingsnetwork.org/underwritten. You can go there today and you can book a time for, please, any day after December 7th when it starts calming down a little bit. So you can book your day, book your time. You'll get reminders of that time coming up. You can put your phone number in there. That system will text you. We won't chase you. I can promise you that. We have nobody in our office that chases, cold calls, markets to, pays for advertising, nothing. We do not reach out for business. We just have people coming in and we have to triage them as best we can. This year, we came up with a calendar system so you can book your best time, but we're not going to hassle you or try to chase you down. We don't have time to do that. Daryl, thank you so much. What states do you do not serve? We do not serve Hawaii, although I'm licensed in Hawaii. So I think that is on Start Part D and Medicare Advantage nearme.com. But most of the agents in the office don't have Hawaii. They don't have Alaska, Massachusetts, and what's the other one I'm forgetting? Is it Maine? I think Maine's the other one. Some states are kind of goofy, like Connecticut, Vermont. Not goofy because the people are goofy, but because the laws are goofy. Vermont, Connecticut, New York. We don't have everyone in the office licensed in those states because the volume's just not as big as the rest of the contiguous states. But those would be the highlights that we don't do is Hawaii, Alaska, Massachusetts. Oh, man. Den, thank you so much. I really appreciate your always encouraging comments on the videos and things on the channel. Really, really do appreciate that. So that'll do it for me. Thank you all for coming in. Especially thank you for your patience with the audio, probably not syncing with the video. Again, that's something we're going to work on. And if there's anything we can ever do to help you, please let us know. And please let somebody else know that we can save them money on their Medicare insurance. That's what we do. That's why we exist. That's how we serve. That's why I do these videos. That's why I educate people for free about Medicare. It's not so that they can say, thanks for the education, and then go to their local guy who's like, wait a minute, Chris said what? Plan N? Oh, Aetna's a good company. Mutual's a good, okay, I'll enroll you for that. How we get back benefit is if you allow us to be your agent, and then you get all the benefits of being our agent and getting on the inside and get the updates that only our clients know if you let us be your agent. So yeah, if you've already got a supplement with somebody else, if you haven't reviewed it for a while, please let us do that so we can save you money too. These are the links. They'll be in the video description when this thing is finally live. And we're just here to serve. Thank you all very much for being here. God bless you. Have a great day. Bye-bye.